Hello, my name is Anthony Caffarelli. I'm a physician and surgeon. I'm the director of our aortic clinic here at Hoag. I'm also the director of cardiac surgery and the Newkirk Family Endowed Chair in Aortic Care. I'm only one of many that are involved in our clinic designed to take care of patients with thoracic aortic aneurysmal disease as well as associated aortic aortopathies. Our aortic center at Hoag is a multidisciplinary clinic. You have physicians, you have surgeons, there's nurse practitioners.
I'm Rita Weiss. I'm the nurse practitioner of the Aortic Clinic. A family friend of mine who experienced a dissection in her 20s was misdiagnosed and died. I realized that aortic awareness is important.
When it comes to thoracic aortic aneurysmal disease or other aortic abnormalities, it usually does not cause symptoms unless it's in the emergency scenario. In the emergency scenario, patients will commonly have pain.
I was at home, 3 o'clock in the morning. I just finished preparing for a sermon. I went to bed and then I started having excruciating pain, and I was trying to call my wife, but for some reason I was having difficulty. So I was hitting the bed really hard and just trying to wake her up.
I was planning on a trip to Indonesia, so I'd made plans and thought I'd get a physical. So I did that, and that doctor said, something's up with your blood pressure, come back on Monday. By Saturday morning, I came home and couldn't get out of bed. I was like an elephant was on my back. So I somehow got out of bed, got outside and got some air, and I started seeing multiple stars just ringing off above my head. Something's going on.
I was 43 when I found out I have a dissection of type A aorta.
The surgical component in aortic disease is really a preventative strategy. That's to prevent the ultimate issue, which is rupture or dissection. As the aneurysm grows, the wall of the aorta gets thin, and that puts it at a risk for rupture, so complete rupture of the aorta, or dissection, where the layers of the aorta split, causing blood to run within the wall. That can then lead to complications such as heart attacks, stroke, paralysis, or end organ problems where the end organs aren't getting blood flow.
Initially, was just wondering if I was going to be able to pastor my church again and be the father to my kids. We did a lot of things together, constantly on the go, but that was the biggest struggle for me because I did not want to let that go. I was determined.
Dr. Caffarelli would take out that thing and start showing me, we did this, and look, this is your repair. See, my concern is about living.
I was transferred to the John Wayne suite up top where I had an ocean view, and the first thing I could think of was, when do I get to surf again?
An aortic patient is a patient for life. Once they have surgery on their aorta, they will need follow-up imaging. By following up in our aortic clinic, I feel like these patients and their families feel like they have someone to call.
Well, my last time back was for my regular CTs, which seem to be getting better year after year.
I learned to appreciate that because they would give me an update as far as how my aorta is doing. So it's very comforting to know, and they care, that they're constantly watching to make sure that I'm not going to have any problems in the future.
When it comes to the quality of care for our aortic emergency cases, the national average for mortality when it comes to those cases is around 26%. Fortunately, because of the specific multidisciplinary team we have here at Hoag, upon recent review of our last 5-year data, we have a operative mortality of only about 12 to 14%.
I seem to have fully recovered now, 3.5 years later, and I feel very blessed and fortunate to have Dr. Caffarelli's team and staff still on my side.
Last year, for my wife's birthday, we had an outdoor service for our church, and I surprised her by walking towards her. She didn't know I would be able to walk. I was determined to walk. I was already taking baby steps, but in front of everybody, it was just a big moment for us. I walked to her. I struggled. I walked to her and I gave her a kiss and said, "Happy birthday." Hoag Newport Beach is fantastic. I love this place. I highly recommend Hoag Hospital. This is the place to go if you want excellent patient care.
Everyone down to the nurse and the guy coming to help me, everyone was really caring. And I felt that they were all connected with a real spirit of health and recovery here post-op. I'm eternally grateful to everyone who helped me. And I'm back here because I owe my life to Hoag and Dr. Caffarelli.